Chemotherapy, or CTX as it's also known, is given to cure or slow down cancer. It can also be given to reduce the risk of relapse. Chemotherapy can be given before or after operation or radiation, and often together with other kinds of drugs, like for example antibodies or bisphosphonates. There are different kinds of chemotherapy. Multiple treatments are often combined to attack cancer cells in different ways. The amount of chemotherapy is individually tailored. If you experience side effects or gain or lose weight, the dose can be adjusted. This doesn't affect the result of your treatment. A team of specialists decides in consultation with you exactly how your treatment should look, depending on your conditions. Chemotherapy can be given as tablets, injections, or intravenously. If you're going to receive it intravenously, a venous catheter is often inserted into a large central vein. The catheter will remain in place for the duration of the treatment. Chemotherapy is usually given in a day ward. You arrive at a booked time and go home when your treatment is complete. Sometimes chemotherapy is given for a few days in a row. If this is the case, you may need to be admitted to a ward or be treated at home with a portable chemotherapy pump. Chemotherapy is given to damage the cancer cell's genome, regeneration capacity, or metabolism. Healthy cells are also affected, and the time between each treatment is therefore adapted so the healthy cells have time to recover before it's time for the next treatment. The healthy cells most affected by chemotherapy are blood cells, mucous membranes, and hair follicles. You may therefore suffer from a lack of various blood cells, problems in the gastrointestinal tract, and hair loss. Skin and nails can also be affected by the treatment. Lack of white blood cells also makes you more susceptible to infections. It's important to contact a healthcare specialist if you experience fever or other signs of infection. The next treatment may need to be pushed back until the infection is over or until the white blood cells have had time to recover. Nausea is a side effect associated with chemotherapy. Prescriptions are available for drugs to prevent this, which are often very effective. If you feel nauseous after treatment, it is important to tell your nurse so you can receive help. Hair is affected by most chemotherapy medications, and patients lose hair during treatment with certain medications. If this occurs, you can access a prescription for a wig. Both the illness and treatments can make you feel more tired than usual, and some patients suffer from extreme exhaustion, called fatigue. Physical activity has a positive effect on several side effects, such as fatigue and nausea. You can always refer to your medical specialists with questions, and if you or your loved ones need telephone support.